Nursing 5372, Integrated Concepts of Pathophysiology and Pharmacy at the University of Texas El Paso. Module 4, Respiratory System, specifically asthma. This presentation is by Terry Konjarski. What is asthma? What's its pathophysiology? Asthma is a common lung disorder in which inflammation causes the bronchi to swell and narrow the airways, creating difficulty breathing. This may range from mild to life-threatening. Let's talk about some facts and statistics about asthma. The number of adults age 18 and over who currently have asthma is 18.4 million. The number of children under the age of 18 who currently have asthma is 6.2 million. The number of visits to the emergency department with asthma as a primary diagnosis was 2 million in the year 2017. In 2017, 3,615 people died as a direct diagnosis of asthma. What causes asthma? Asthma is complex and involves airway inflammation, intermittent airflow obstruction, and bronchial hyperresponsiveness. Because you have asthma, you have twitchy lungs. That means when you breathe in your trigger, your lungs get all tight and make thick, sticky stuff called mucus. That's why it's hard to breathe and you feel like coughing. But really, and honestly, no one knows what causes asthma.
What does it look like? You can see we have a normal airway. You're in the green. We'll talk about that soon. Caution. These are asthmatic airways. It's what can happen occasionally with an asthmatic. And then there's the danger zone where you have an asthmatic attack. Again, we're going to get to these colors and what they mean to you soon.
So what are some triggers? Breathing in things that cause allergies called allergens, such as dust, pollen, dander from animals, and mold. Breathing in things that irritate your airways, like cigarette smoke and perfume. Infections like cold or the flu. Exercising. Breathing in cold air. These are all typical behaviors of a high school student. What are some signs and symptoms of asthma? You have shortness of breath, cough, wheezing, chest tightness. See the girl who's trying to play soccer? You may visualize yourself feeling like that. Be sure to know your zones. There's a green zone, which is your safety zone, a yellow zone, which is caution, and a red zone that's danger. The color-coded zones on a peak flow meter are similar to the signals on a traffic light representing safety, caution, and danger, which is an indication of whether an individual's asthma is under control. So now let's talk about the medications you need to treat your asthma. There are bronchodilators, which is a quick relief medicine, also called rescue or fast-acting medicine. Bronchodilators help open the airways of the lungs and make breathing easier. An example of this is albuterol. Some side effects of albuterol or bronchodilators are palpitations, rapid heart rate, nausea, and vomiting. You also may have steroids, which are long-term controlled medicines, also called controller or maintenance medicines. It's a daily medicine that keeps your flare-ups to a minimum. An example of this is prednisone. Side effects can be acne, blurred vision, high blood pressure, and increased in eating. So how do you monitor your asthma? Well, you use a peak flow meter. Remember our zones? Your green zone. Your peak flow meter is greater than 80%. You're doing just fine. Carry on. Keep on doing what you're doing. If you're in the yellow zone, your peak flow is less than 80%. You need to double your preventer medication and make a doctor's appointment. If you're in the red, which means your peak flow is less than 50%, this is an emergency and you should call 911 immediately. So, to simplify things, if you're in the green zone, you're safe. If you're in the yellow zone, use caution and double those meds. If you're in the red zone, call 911. Let's talk about prevention. Once you know what your triggers are, you can take steps to avoid them. You may want to try changing your sheets often, vacuuming often to get rid of dust. Keep your pet out of your room if you are allergic to pet dander. Stay inside when the pollen counts are high. If exercise bothers you, talk to your doctor about prescriptions that can help you breathe. So we talked about some prevention. Let's talk about living with asthma and lifestyle changes. Making some lifestyle changes can help you avoid triggers that may cause an asthma attack. Reduce your exposure to allergens or irritants that trigger your asthma. Pay attention to the warning signs when they occur. Treat symptoms early. Ask your doctor about physical activity and be sure to get your flu shot. And if you are, stop smoking. You're young. Don't make this a life habit, especially if you have asthma. This concludes a brief yet informative presentation on asthma. Take care and breathe easy. Thank you.